Something is happening in functional medicine and you need to know about it. Why is it that you're maxing out your credit card, forcing your child to eat so many different supplements, doing so many different tests, going on extreme diets, and you are not seeing lasting results, even though these practitioners, they are big shots, they are famous, and other people say that they have results from these methodologies? There's something that is not being told. There is a truth that's being suppressed, and right now it's more important than ever. And you need to understand how you need to shift your thinking around how to turn symptoms around for your child, or you're wasting time. They might actually make your child worse right now. So you're spending your money on them damaging your child if you don't know what I'm going to be sharing with you in this episode. So let's dive in and figure out what are some of the signs that your functional medicine practitioner is using the wrong methodology, the wrong testing, the wrong approach when it comes to ADHD and autism, what it takes to choose the right one, why there's so few of them, and what you need to understand about your important role, and questions that you need to ask yourself about the communication and the relationship you have with that practitioner. Because if you come into this out of desperation, if you come into this in panic mode, it's going to be a dysfunctional relationship and the results will reflect that. This is so important. Let's dive in. Why is this relevant right now? To talk about why functional medicine is coming up against a wall, why they are not able to help us, autism moms and ADHD moms. There's actually two things I want to mention. One, there's a new study out and it's published in JAMA about how multivitamins are ineffective or actually might be harming people. That makes sense, and I'm going to make it make sense for you in this episode. Number two, there's a famous psychiatrist and a famous autism practitioner who just started a new course for autism moms. And this famous psychiatrist, I think who I'm talking about, calls this a new approach, and there's nothing new about the approach. I'll talk more about that in upcoming episodes, but this is why we have a huge problem. Mama, we have a problem. The first problem we have when it comes to practitioners, no matter what course it is, no matter what practitioner it is, I've seen everything out there, and I tell you that they basically all make the same mistakes, almost all make the same mistakes. There are some good practitioners. There's a handful worldwide that I personally trust. But most likely, here are some red flags that your practitioner might be doing. This is what most of them do when they meet you in their consultancy room, either online or live. There's something wrong. So here are some of the red flags that you really need to pay attention to. Here's a problem. There's something wrong with their methodology. There's something wrong with their approach. There's something wrong with the remedies they use to try to help us. I know they do this from a good heart, many of them, not all of them. I know they want to help you, and I also know that there are a lot of numbers are being suppressed. Moms are being silenced when they say this is making my child worse. They're being removed from Facebook groups, and they're also being told that it's them not following the protocol. No, it's not you. And when I come to reason number two why functional medicine is not working for autism moms at the moment on a large scale, you need to respect yourself more. You need to understand that they are not respecting you. They're not seeing the importance of your role, and you should not bow to them. You should not feel less worthy than them. I'll explain to you why your role is so important after this point that I'm going to make. So first of all, the tests that most practitioners are using are outdated, unprecise, inaccurate, and even when they use good tests, the way that tests are transported, the reliability of the labs, unfortunately, makes the results even more questionable. But let's just stick to the point of the tests not being of a high standard. If your practitioner is still using gene testing, if your practitioner still mentions the word MTHFR or genes and use those tests and SNPs to determine what foods and supplements they want to give you, and it will typically be methylated B vitamins, they'll give you folate, they'll give you things that honestly, in probably 90% of the cases, will make your child worse. This is what drives me nuts. So our children, almost every child, this is based on a study done by Walsh Institute, a non-profit study done on 8,000 autistic children. And according to his studies, 90% of children with autism, classical traditional autism, have issues with undermethylation. If you have issues with undermethylation, you are folate intolerant. You will get worse if you give a child methylated folate or folate, in many cases folinic acid and folic acid as well. They will get more aggressive, have more tantrums, more meltdowns, more mood swings, because you steal folate on the inside of the cell, nucleus, even though it donates folate on the outside of the cell. This is a complicated situation. I've created interviews with one of the experts that I really trust, and I'll link to it at the end of this video. But that's a red flag. So don't ever let somebody give you supplements based on a gene test. It cannot show you anything about whether your child is undermethylated or overmethylated. When a practitioner is going to work on your child, they need to know how to test for methylation, and that is a blood test. And you need a test that determines the SAMI to SAR ratio. You need whole blood histamine tests, but hold on before you run out and order these tests. Someone who can take these tests and offer them to you, it's rare that they can use the results to actually make your child better. And in a minute in this video, I'll tell you how you can make your child better, how you can use these tests, and what you should do instead. So many of the practitioners out there, they can do the tests. Some of them are even trained Walsh practitioners, but they don't have the clinical experience. And this brings me to point number 2. What's a problem with functional medicine practitioners today is that autism in itself is a field of expertise that you need at least 6 years of clinical experience to be able to adjust. If you don't know what you're doing, you might cause someone to be flipped over into psychosis, into severe depression, into autistic states that they can't be pulled out from, where they're in danger. And if you're an autism mom, you got a child that's screaming, eloping, self-harming, aggressive, you know what I'm talking about. This is scary stuff. And many of the functional medicine practitioners, because they don't know what they're doing, they make children worse, because their approach is, let's look at what's missing, let's do a gene test. If someone has MTHFR, we'll give them methylated vitamins, we'll give them loads of methyl donors, and they will make your child more aggressive, more dangerous, more anxious, more tantrums, less development. Here's why this is so crucial to understand. If you get a child, basically, the younger the child is, the quicker you can see changes if you do the right thing, if you tailor and adjust nutrition and lifestyle and the turnaround process to that specific child. You can get a child to more results quicker the younger the child is. You don't have time to go from practitioner to practitioner for 6 months, 12 months, or even worse, 2 years. I see a lot of moms do that, and they waste time in these Facebook groups that are based on protocols, experts, diets, so all the GAPS diet groups, all the Nemetschek groups, all the functional medicine, biomedical groups. You are most likely wasting your time. And the reason number 2 is that these practitioners don't know how to understand and adjust the tug of war between under and over methylation. In order to do that, you basically need to monitor the child all the time. You need to know when you're overboard. And the functional medical practitioner's approach will often be, let's look at what this child is missing. Let's look at inflammation. Let's look at the panels. Let's look at, oh, this child is low on zinc, or this child is low on, let's look at the food intolerances. But they don't look at the system of autism. This is why I'm saying 6 years of clinical practice is important, because this is a field of expertise, just like a surgeon has an expert field we have brain surgeons, we have foot surgeons. You can't go to a foot doctor for a brain problem. You need to go to someone who understands the system of autism. And no, it's not another functional medicine practitioner, probably. I'll tell you in 1 second or a couple of minutes who that expert is, who do you need to consult. So if they don't know how to introduce supplements, monitor them, and also understand when we get into overload and take them out of the mix again. Nutritional overload is as dangerous, if not more dangerous, than nutritional deficiencies. Here are some of the supplements that are used in functional medicine that are not working or making children worse, and the latter is more serious. Fish oil. In children with pyrrole disorder, fish oil will make them more aggressive, have more tantrums. Folate, methylated folate, folinic acid, folic acid. You really got to be careful with these. More often than not, it will push children over the edge, and it will make them more aggressive, more tantrums, more screaming, more mood swings, and less development. You will waste crucial years for development using these supplements. So if your practitioner do any of the tests that I just mentioned and give you those supplements, you got to run away. Any methylated vitamin Bs can cause severe side effects, and including methylated methylcobalamin. Copper, if there's copper in any of the supplements, if the practitioner puts you on a gut repair nutritional diet, run, because these children that are undermethylated also have high histamine, and it will exacerbate their symptoms. I'm looking at this from a very simplistic point of view, but I'm telling you, these are some of the reasons why people go to functional medicine practitioners and they don't see results, or dieticians, or autism coaches, or autism mom programs out there. If they do food intolerance tests, know that they are probably outdated in their approach as well. Because if you do a food intolerance test today and you do one next week, same lab, if you send in the same sample, you'll get different results. You'll get different results from lab to lab. That's how inaccurate it is. Here's the thing that nobody tells you. Your child's needs change all the time. So the need for supplementation, the need for certain fats, the need for certain foods, the need for interventions, these needs change all the time. So if you go for protocols, if you go for a test and then you supplement and then you just continue with that, what works now will make your child worse down the line. How do we deal with that? If you are going down the functional medicine route, most of the practitioners out there, you will have to do tests all the time. Who can do that financially and practically? It's blood tests that you need to do anyway. Many of these tests are inaccurate because the collection of the sample is not done in the right environment. Some of them need to be urine tests. They need to be done in the dark. They need to be put on ice immediately. You need to treat the blood in a certain way. Transportation needs to be really monitored and kept cold and within a certain time frame. So a lot of these results are actually false results. And so when your child's need for nutrition and diets and fats and supplements change all the time, how do you do that? How do you approach that? How do you make sure that you're not making your child worse down the line? It's not the practitioner that's going to take over and do that for you. So point number 2 is, don't go to a functional medicine practitioner without knowledge. If you go from a state of panic, if you go from a state of helplessness, if you go out of desperation, which most of us do, if our child is not sleeping, our child's got picky eating, is not eating healthily, our child is screaming, running away, stimming, lining things up, being aggressive, cannot communicate, we can't see a future ahead of us with an independent child, we need to come into a relationship with a practitioner, a good functional medicine practitioner or a biomedical practitioner or Walsh practitioner, with the knowledge to ask the right questions. The right questions is, what tests is this practitioner using? Does he have at least 6 years of clinical experience, or she? Does he or she have testimonials, recent and reoccurring, of children actually being turned around, where these symptoms that are there when you come to them disappear or minimize. And don't just, because if you just have a little bit of a change, you do all these supplements and protocols and your child changes a little bit, but then nothing happens long term. That is a sign that it's not the right practitioner for you and it's not the right approach for you. And then they need to be respectful of you, because guess who your best functional medicine practitioner is? You. If your practitioner doesn't ask you, what do you think? What are your observations? What do you think happened that triggered this symptom? They don't understand the importance of your role as a mother. If they don't understand that you're the one that's observing the child 24/7, you're the one who can read the symptoms, monitor the symptoms, and adjust nutrition and lifestyle on a daily basis. If they don't respect and understand your intuition and the fact that a mother's wisdom is infinite and in connection with God's plan for this child and the healing, this practitioner is not for you. If he or she puts himself up on a pedestal and they think that they are the only piece of the puzzle, and they don't look at the systems of autism, it's not a practitioner for you. You need to come into this relationship with knowledge and self-respect, and you need to be removed from panic. This is why I spent 4 months with moms, taking them out of that emergency state in their nervous system and in not knowing what works for their children. I like to get moms to know exactly what's triggering symptoms, what's working for their child and what's not working for their child, by experiencing how to read symptoms for themselves and adjust nutrition and diet and lifestyle accordingly, by getting their nervous system in a place where they can actually take in information. Did you know that your brain will not allow change? That your brain will not take in information and use it to implement a new lifestyle? If you are not transforming and translating all this information to implementable steps that you use in your day-to-day life, in your dietary approach, in your parenting, in your supplementation, if you don't know exactly what's triggering your child's symptoms and adjust nutrition and lifestyle accordingly, if you don't know how to deal with the plateau and regression, you haven't been educated or prepared to even work with a functional medicine practitioner. In my process and in my approach, my son I went through all these deceptions too. He went from stimming, sleepless nights, screaming, eloping, aggression, nonverbal autism, echolalia, lining things up, massive stress and sensory issues, to none of those symptoms. And my approach is that the detox approach, the supplements, the tests, and working with a practitioner, that is step 5. I do have an ambulance for emergency issues if you do want to change the food and nutrition urgently and you have triggers in your diet right now that's causing you to not sleep and having to have your eyes fixated on the child 24/7. I do have emergency tools for that. But other than that, we go through a process where you calm your nervous system, you bypass that brain's failure mechanism where the brain does not want to allow change when you're in fight and flight. If your child has severe symptoms, you are in fight and flight, and the brain will try to prevent change, and you won't be able to take in the information and implement the information that you're even getting from all these practitioners and Facebook groups. So we need to get you to a better place. We need to calm your nervous system. We need to educate you in what is methylation. How do you find the specific triggers for your child? And this is the thing with these practitioners. They don't know the bio-individual needs of your child. Every single child is unique. Every single child needs different foods at different times in the turnaround process. Every single child needs to be understood, and then you need to adjust diet, nutrition, and lifestyle accordingly. Until you've learned to do that for yourself, until you have calmed down your nervous system, until you've understood your self-sabotage patterns that actually forces you or tricks you into creating pain on the outside in your life and maintaining autism symptoms and chaos to escape from a pain on the inside or in the past, trauma in the past that you are not ready to heal, you're not going to be able to change your lifestyle or implement these things that you're paying massive bucks for. So healing starts with you. A good relationship with a functional medicine practitioner starts with you having the knowledge, being in a state where you can receive this information, and you understanding the system of autism symptoms and triggers, not the symptoms. Everyone chases symptoms and wants to get rid of symptoms. Symptoms are messengers, and they tell us about the systems of autism in your child. Okay, so let's sum it up. You are the leader of your child's turnaround process. You cannot come into a relationship with a functional medicine practitioner out of panic. Number 2, most, probably 70 to 80% of functional medicine practitioners will not be equipped or trained or have the right approach or the right remedies for you. Number 3, if they don't have 6 years of clinical experience and proven results in only the field of autism, don't go to a functional medicine practitioner who treats all kinds of different issues. They might have results in other issues and with other people, but autism and ADHD requires special skills, and they need to only be focusing on that, or you got to run for the door. Remember that they need to respect you because you are the one who can monitor and learn how to interpret the language of the symptoms and adjust diet and nutrition and lifestyle and approaches accordingly. That is needed because your child's needs change all the time. What works now might have negative long-term effects. If you don't know how to read, adjust, and monitor, you won't see the results. And that starts with you. So that's number 4. The turnaround process starts with you understanding that you can only help your child, understand your child, heal your child, turn your child around to the level that you've understood, helped, and healed yourself. And it's like learning a language, that you cannot teach a child Italian if you don't speak Italian. You cannot take a child through the jungle if you haven't walked through that jungle yourself. If you have a nervous system that's in fight and flight, you won't implement the things that you're paying for when you go to a practitioner. So you need to be in a better state for you to turn your child's symptoms around. If you don't know the brain's failure mechanisms and your self-sabotage patterns, you won't be able to get the outcome from your investment when you go to a functional medicine practitioner. The understanding that you need to come into this relationship with is that autism is a message. Symptoms are messengers. Don't kill the messenger, which is what most functional medicine practitioners do by using supplements or detoxes or kill, bind, and treat approaches. We need to understand the messages and change our life accordingly in order to change the symptoms. There's always an element of nature deficiency. There's an element of God's plan for you, something that needs to change in your life and your parenting, your walk with self, God, and others, and your walk through autism. There's something that needs to change in the physical and emotional healing approach. It needs to be heal yourself first. There's something in the environment that's making you sick that needs to change. And then you need to become the expert in bio-individualized nutrition, methylation, pyrrole disorder, mineral imbalances, healing the gut, food first, infections and inflammation and stealth infections, PANDAS. You need to understand that from a leader's perspective, not as a functional medicine practitioner. So that's what I'm interested in. That I'm teaching moms that, and that's why my approach isn't for most people, because I require 12 to 14 months of your time to get you to that level of peace and expertise. So that was my functional medicine rant for today. And I really hope you enjoyed this episode. Stay tuned for more information about these things and God's plan for you. Autism is not a mistake. It's a wake-up call. So if you want to be the first to know how to work with me, or when I'm launching new programs and coaching solutions for you, you need to go to barefootautismwarriors.com and look at free resources. Please rate this podcast, give me some stars, share it with somebody. We're really reaching a lot of people now. This has been going on for over 3 years now, and we are seeing some momentum now, and this is a revolution that I want to be part of. Thank you for listening. Take care.